Hello and welcome to News Pulse. I'm Esther. The citizens of ABOI town in Mon district have been combating and braving the COVID-19 pandemic with grit and very interestingly with only one dental surgeon sanctioned at the community health center to aid the patients and especially those infected with COVID-19 since its outbreak. During the first phase of the pandemic, only the dentist was available to take care of the patients at the CHC, said a member of the ABOI area forum. But now, along with the dentist, is a general doctor. Even though Mon did not record any new cases as of September 26, the CHC was said to be in a deplorable condition throughout. Only after the community came together for social work and with their own funding, some renovation was possible. With shortage of manpower still at the CHC, not only for COVID-19 but also various other sicknesses and patients that come from other parts of Mon, the ABOI CHC is said to be in dire need of more professionals and staff. The ABOI public have been involved in community participations for the past few years and tremendous changes have taken place at the CHC ABOI. But with patients coming in every day with various ailments, duties of the medical staff has to be available for 24/7. Amongst others, the ABOI Town Students Union have also been in the forefront in making sure that the CHC is able to cater to the public as much as possible. To speak more on this, we have the president of the ABOI Town Students Union, Mankat Kaihe Konyak, to talk about the ABOI Community Health Center. Hello, Mankat.
Yes.
Hi, can you hear me?
Yes, madam.
Yes.
Yeah,
okay, I wanted to ask you about this ABOI Community Health Center. We were told that only a dentist was available during the first phase of the pandemic, of the COVID-19 pandemic. Is this true?
Yes, it is true. First of all, thank you, Humble TV, for this opportunity.
Okay, no problem.
Before highlighting this COVID-19, I would like to share some few words regarding the CHC ABOI, that the conditions of the CHC ABOI at the present state. Madam?
Yes.
Hello.
Yes, I can hear you.
CHC ABOI is one of the neglected community health centers in Nagaland. The populations of more than 30 villages rely on it for health issues. Whereas CHC ABOI is in a very sorry state. Lack of manpower is the main cause behind the deplorable conditions of the CHC ABOI. The community health center has shortage of medical officers, no posting of XMO since 6 years back, and shortage of staff, nurses, and other field staff.
Okay.
Repeatedly.
And how did ABOI CHC manage to cater to so many patients, not only for COVID-19 but different ailments during such a time, during a pandemic, during lockdown, when there's nobody around, you know, to take care of the needs of the people also, and including doctors, nurses? How did one dentist, how did ABOI manage to do this?
During the pandemic, many of the patients rely on the pharmacists. Some of the pharmacists are run by the medical practitioner. Because of this, many complaints have arisen in ABOI. Because of this, the NGOs of ABOI has shut down many pharmacies.
Yes. So even the CHC being, catered by a dentist also during the pandemic, won't it be an obstruction to medical laws also, because, the medical malpractice can happen?
Yeah, we have appealed to the government regarding this, regarding the inductions of manpower in ABOI for many times, but we have not received any positive response so far. Because of this, we have even gone for this facelift of CHC ABOI voluntarily by our own, in our own capacity. Like some of the judges, they come up, and the NGOs of ABOI, some organizations of ABOI have come up and do some facelift to the CHC ABOI, so that we understand, or we expect that government can be understood that the people of ABOI are so much cooperative.
How many patients come to the CHC on a daily basis or weekly? How many patients is there a minimum of?
Nearly 100 patients per day.
100 patients per day. So, and still it is understaffed and manpower shortage is there. So has the government done anything to make sure that this is not happening? Have they come forward?
No, we haven't got any positive response so far. We have appealed to the government many times. And lately, recently, one of the doctor, Dr. Hangsa, has been appointed in CHC ABOI, much to our relief.
Okay.
But still, there is shortage of manpower in CHC ABOI.
Okay, so the government has not come forward, and is there any ultimatum that the organizations and unions in ABOI want to take up?
I don't want to appeal the government of Nagaland to kindly induct manpower of CHC ABOI as per mentioned in the guidelines. Because the present strength of the CHC ABOI is very less than the CHC.
Okay. Then what is the next step that the union wants to take in regard to this, and how will patients that come to CHC be catered to with only 2 doctors, and that is including 1 dentist? So how is ABOI going to handle this if patients come for different ailments, not just for COVID-19?
We have no choice, but we have to refer to some other place, to the other district headquarters, hospital, or somewhere in Dimapur like this.
Okay.
Otherwise, we have no choice.
No choice but to send the patients to other districts or Mon town. Okay.
Yes, yes.
All right, all right. All right. Thank you, Mankat, for speaking with us.
Thank you, thank you.